Dear students, welcome to Bluepen Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
So now we will speak on Anchorage. So what is Anchorage? When we have an orthodontic treatment, we need something which is known as Anchorage. What is Anchorage and who are these anchors? The force that is used to move a teeth in a desired is derived from some certain anatomical structures. These are known as anchors. Okay, I will repeat again. We need some force to move a teeth, right? If you have a teeth here, you need some force if you want to move this teeth to this position. Okay, so the force that is used, to move this teeth to this position, okay, is derived from some anatomical areas which act as anchors. So they act as anchors. Okay, so this is anchors. Now, according to Newton's third law, we all know that every action has an equal and opposite reaction. So, when you use a force to move a teeth, okay, see, you're using this force to move this teeth to this position. Okay, you're using this force to move this teeth to this position. So when you use this force for this action, what might happen? This will give an equal and opposite reaction according to the Newton's law. Okay, so when you give this force to move this teeth to this position, according to Newton's law, what can happen? There can be an equal and opposite reaction force on the anchorage unit tending to cause this kind of force, this kind of movement. There will be kind of an unwanted force that is happening on the anchorage unit, which is not at all desirable. We don't want our anchorage unit to move. We only want this tooth to move. We are taking anchorage from some other part. Okay, when this anchorage unit is helping this teeth to move to our desired position, we don't want any undesirable movement that is happening to your anchorage unit. So there will be a resistance that this anchorage area is offered to these kind of unwanted, undesirable kind of movement, and that is what is known as anchorage. Okay, I know it's a bit complicated. I will tell it again. The force that is used to move a teeth is derived from some anatomical areas. Okay, you want to move this particular thing to this place, so you need a force to move this. Definitely you need a force. So the force is coming from where? Some anatomical regions, and that you call as anchors. Now, according to Newton's law, how is it? That is, every action has an equal and opposite reaction. Now, some force is trying to move this particular thing to this position. Okay, just this is an example only. We take some force to move this particular thing to this dotted line. That's a new position. Okay, for that force, we use the help of some anchorage unit here. So when you do this, when this happens, we actually don't want any undesirable movement to happen for our anatomical unit here. Okay, but when a force is acting like this, according to Newton's law, there will be an opposite and equal reaction happening. So this is moving like this. So for this anchorage unit, there will be an equal and opposite reaction which is not desirable. Okay, so the resistance that is offered by this anchorage unit to this unwanted kind of force is known as anchorage. Okay, so according to the definition, we'll see that now. Oh, very sorry. According to definition, it is like the nature and degree of resistance to displacement offered by an anatomical unit for the purpose of effective tooth movement. This is according to Graeber. Okay, so these are some definitions only. Anchorage is a site of delivery from which a force is exerted by biting gardener. Okay, now this anchorage during the orthodontic therapy, you will get it from two sources. There are two sources for this anchorage. One is can get it from the intraoral, like inside the mouth, you can get that source. Otherwise, you have to go extraoral, outside the mouth, as the term suggests. Now, there are some intraoral sources for this anchorage, like what? We have teeth, we have alveolar bone, we have muscles, musculature, then also we have that jawbone, the basal jawbone. So these all can act as what? Intraoral sources of anchorage. Coming to the first one, which is the teeth. Okay, see, you have two teeth that you want to move orthodontically. Okay, these two teeth you want to move orthodontically, but it is not just two teeth in your mouth. You will have other 30 teeth remaining. Okay, so when you want one or two tooth, or how many it is, orthodontically, when you want to move it orthodontically, all the remaining tooth in the oral cavity, they can act as an anchorage or resistant unit. Right, all the other teeth can actually help us by serving as an anchorage unit, anchorage or resistance unit. So teeth is thus a very excellent source of intraoral anchorage. Okay, so root surface area. What happens in root surface area? If the particular teeth is having larger root surface area, if it's a very good root surface area, definitely they will give both greater anchorage. See, this one is having 450. This is only having 240. Just compare the root surface area. If it is a 450, definitely it is big, it is large. So definitely you will get more anchorage. Common sense only, right? That's a root surface area. Okay, then root form. Root form means what? We can have round root form. You can have flat one, and also you can have triangular one. Round means what? You can see this typical round roots on what? You can see it on bicuspids. Also, you can see that same on the palatal root of maxillary molars. And the flat roots where you can see it on mandibular incisors. You can see that on molars, buccal roots of maxillary molars. These all show flat roots. And also, you have triangular roots like canines. You can see the triangular roots. Maxillary central and lateral incisors shows the what triangular roots. So these are the root forms. Okay, so when we come to the root form, round roots can resist horizontally directed forces in any direction. If it is coming in a horizontal direction, if the tooth is having a round root form, it can resist forces very easily. Flat roots, if it is a flat root, they can resist movement in the mesio-distal direction. Mesio-distal direction. If it's a triangular root, okay, they offer maximum resistance to displacement. Okay, they give maximum resistance to what? They give maximum resistance to displacement compared to this round or flat root form. So this happens with what? Root form. Okay, now what? Now you have size and number of root. If you have more number of like root, and if you have larger root, definitely they will have greater ability to withstand the force than the single rooted or the smaller root one. Then root length. If it is a huge length, what happens? This will be embedded more in bone. This will be having more bone support. So definitely they will have greater resistance to what? Displacement. Then inclination. Inclination of tooth. What happens with inclination? A greater resistance to displacement is offered when the force exerted to move teeth is opposite to that of their axial inclination. If its axial inclination is in one way, if you are giving a force in its opposite direction, there will be a greater resistance. So that is inclination. Then ankylosed. What happens with ankylosed? Ankylosed will be like fixed, right? They don't have this periodontal ligament, and they will be having bone in that place. So it is like very fixed. if you want an orthodontic movement for such an angular state, it is not possible. Okay, but when you want an anchor, if you want that angular teeth to act as an anchor, then it is an excellent anchor only. Whenever possible, you can use that angular tooth to be an anchor. But you can't move that tooth. Okay, that will be like permanently fixed in that position because you have bone all around. You don't have that particular periodontal ligament around the teeth. That's why you call it as what? Angular teeth. Okay, then alveolar bone. The alveolar bone is what that surrounds the teeth, right? So this can also give a lot of resistance to tooth movement. Up to a certain amount of force, they can also give a very good resistance to teeth movement or tooth movement. Okay, now what happens is, if the force that you give is above an optimum force, there will be always an optimum force, right? If it goes above the optimum force, what happens? This alveolar bone reacts by a process which is known as bone remodeling. We will see that. Okay, then musculature. The normal tonus of facial and masticatory muscles plays an important role in normal development of dental arches. So abnormal musculature causes flaring and squeezing of teeth, while hypertonic muscles exert restrictive forces in a lingual direction. This is what happens with muscles. Okay, if you have abnormal kind of hypotonic muscles, that can always result in what? Spacing and flaring of teeth. Okay, if you have at the same time, if you have hypertonic muscles, they will always exert a restrictive force in a lingual direction. They will have a restrictive force in the lingual direction. Okay, then what? Which all are the extraoral sources of anchorage? It starts with cranium. Okay, that is known as the occipital or parietal anchorage. You can take the anchorage from where? Occipital or parietal region. These devices are used along with what? You can use it along with face bow to restrict the maxillary growth. So that is it. You can use cranium also as a extraoral source of anchorage. Then you have cervical anchorage that you take from where? Back of neck. Okay. Such a type of headgear. You have a kind of headgear which is known as cervical headgear that takes the cervical anchorage only. You will see that in orthopedic appliances. Then we have facial bone, the frontal bone, the mandibular symphysis. They also give a very good anchorage during this face mask therapy. You know how a face mask is, right? They will have a in that portion, in that frontal bone and the mandibular symphysis region, you are having anchorage units. You're taking anchorage from there. So, in order to protract the maxilla, you use this face mask, and here this have a greater role. Okay, headgears that make the use of anchorage from the forehead and chin are called reverse headgears. You have headgears that use from forehead and chin, right? They are known as reverse headgears, the face mask thing. Okay. Now coming to the types of anchorage. Sorry, before that we have classification of anchorage. According to the classification, you have Moyer's classification here, which is very important. You can get a direct question like, what is the Moyer's classification of anchorage? According to that, according to the manner of force application, they can be single, they can be stationary, they can be reciprocal. According to Jones, it can be intermaxillary. Site, intraoral, extraoral. Now you know what are the extraoral: cervical, occipital, cranial, facial, and can also be muscular. According to the number of anchorage units, can be single, can be compound, can be multiple or reciprocal anchorage. This is how it is classified according to Moyer. Okay, now the types of anchorage, starting with what? Symbol anchorage. Okay, you have symbol, you have stationary. Okay, you have reciprocal, you have intraoral, extraoral, muscular, intermaxillary, single, compound, and multiple. These many anchorage types you have. Starting with symbol anchorage. What is a symbol anchorage? See, we will explain the symbol anchorage with the help of this example. See, this is an example for symbol anchorage. As you can see in that picture, that's a removable appliance. You have a removable appliance incorporating a screw, because they are trying to pull that lingually, the palatally placed premolar to a buccal position. They want to pull this teeth to this position in the buccal direction. So here they are using the force, the force from all the other teeth to move this particular premolar in a buccal direction. This is a simple anchorage. This is an example for simple anchorage. So what is simple anchorage? Okay, dental anchorage in which manner and application of forces is such that it tends to change the axial inclination of teeth or teeth that form the anchorage unit in a plane of space in which the force is being applied. So this is how the force is applied. You want to pull this premolar to a buccal direction here. That is what is happening with this particular example. Okay, thus the resistance of anchorage unit to tipping is utilized to move another tooth or teeth. Simple anchorage is obtained by engaging with the appliance a greater number of teeth, okay, that are to be moved within the same dental arch. This is, don't confuse it with all these things. The only thing is that the best example I have told you. See, this is a simple anchorage example. You have a palatally placed premolar here. You want to push it buccally. Okay, so what you do is you will take the rest whole teeth as an anchorage. You will take all other teeth in the dental arch as anchor units, and you will push this premolar to a more buccal position. That is what is happening here. Okay, so this is a simple anchorage. Now you have stationary anchorage. What is stationary? What is stationary anchorage? It is like the bodily movement. Okay, this is what is happening in the stationary unit. Stationary anchorage, I'm sorry. Okay, so you are going to move that particular teeth or whatever it is, you have to move that, the one that you have to move. You are going to give a force to displace that bodily in the plane of space. Okay, the full thing, the complete thing is going to move to the desired position. That's a stationary anchorage. Okay, this is not a tipping thing. This is not going to go like a tipping only. No, this is going as a bodily one. Bodily movement is happening with stationary anchorage. Now you have what? Now you have reciprocal anchorage. What is reciprocal? Okay, the best example is with what? The midline diastema. In midline diastema, what happens? You have one tooth here, you have one tooth here. You have a very big space in between. So what you are doing? You have to pull both the central incisors towards each other. Right. So this is a reciprocal anchorage. Here I'm making it to move towards each other in an opposite direction. Okay, so that is happening in reciprocal anchorage, as you can see in this picture. Okay, this happens with finger spring. This happens with elastics that are used to close the midline diastema, as you can see in this picture. I'm sorry, I've drawn and marked here. Here you can see, right? Then crow's bite elastics, you can see that. Then coffin spring, there also you can see this reciprocal kind of anchorage. Then intraoral anchorage, as I told you, we are taking the resistance unit from the oral cavity. Then you call it as an intraoral anchorage. Okay, like the palate, lingual alveolar, bone, something like that. That is intraoral. Extraoral, you take it from outside. For that, you take from occiput. You can take it from back of the neck, cranium, or face, like headgear or face mask. Okay. Then muscular anchorage, you are taking from muscles to aid the movement. Okay, so that is muscular anchorage. Then you have intramaxillary anchorage. Intramaxillary means what? Intramaxillary. Everything is intramaxillary in that place only. If this is the maxilla, this is mandible. Everything is in maxilla only. Intramaxillary. Everything, the two to be moved, the anchorage units, everything is in that, entirely on that part only. But this maxilla or mandible only in that. Okay. Then in inter means what? The best example is by the class 2 elastics, and the class 2 elastics is also best example for the intermaxillary anchorage one. Okay. Let me see whether I have a picture. No, I'm sorry, I don't have a picture. But I think I hope you understood what I'm trying to convey. So here, this is maxilla, and if this is mandible, you're using both. Like if it is a crossbite, like if it is a class 2 elastics, you do it like this, right? So you're using from the maxilla and also from the mandible part. So this is your intermaxillary anchorage. It's also known as Baker's anchorage. So if you get a short note on a Baker's anchorage, now you know what it is. It is an intermaxillary anchorage. Okay, now single or primary anchorage. Okay, wherein resistance provided by a single tooth with greater alveolar support is used to move another tooth with lesser support. You are just using a support from a single tooth. Then it is single or primary anchorage. Then you have compound anchorage when you are taking the resistance provided by more than one tooth. So that is compound anchorage. Okay, this is just a single one. This is a compound one. Okay, now you have reinforced anchorage. What is reinforced anchorage? Reinforced anchorage is also known as what? Multiple anchorage. Okay, here you are having anchorage in which more than one type of resistance unit. Okay, like you have extraoral appliances, or you have an upper and anterior inclined plane, or you have a transparental arch. So that you call as a reinforced or multiple anchorage. Okay, you have more than one type of resistance unit here. For example, you can have the extraoral forces like the cranium, back of neck, as we have seen in the extraoral types of anchorage unit. Then you can take it from the upper anterior inclined plane. I hope you know what is upper anterior inclined plane, what it is. So when you have an upper anterior inclined plane, if the patient tries to close his mouth, what happens? That will give a forward glide for the mandible during the closure. So when the mandible is pulled to that position to close, that will result in stretching of a muscle, that is a retractor muscle of mandible, which subsequently contracts and forces the mandible against the upper inclined plane. Thus, a distal force is applied on the maxillary teeth, thereby reinforcing the maxillary anchorage. Okay, this is what is happening into the upper anterior inclined plane. You are using this also, upper anterior inclined plane. So that's the reason you call it as a reinforced or multiple anchorage. You are using more than one. Okay, then use of transpalatal arch. I hope you know what is a transpalatal arch. So this is a transpalatal arch. Okay, then you can use the lingual arch. This is a lingual arch. Okay, these all are used in fixed mechanotherapies only. For what? To augment the anchorage. Okay, so in transpalatal arch, what happens? There is a what? There is a wire that spans through the palate in a transverse direction that is connecting two molars. Okay, four permanent molars on both sides. Now the other one, the lingual arch. What happens in lingual arch? There is a wire that is running through the lingual aspect of all the teeth, and they are banded to where? To the lower molar. This is a lingual arch. Okay, so this is another example for what? Reinforced or multiple anchorage. You are using more than one resistance unit, one type of resistance unit for anchorage. Now coming to the anchorage planning. Okay, so anchorage planning, of course, is very important. Before the orthodontic therapy, you need to know the anchorage thing. You have to plan an anchorage before you are going for an orthodontic treatment. There should be a good planning. So this is having like a very important this is a very important part in what success of the orthodontic treatment. So it is very important to go for a pre-plan before the orthodontic therapy to carefully assess the anchorage demands. Okay, now this depends on what? This depends on the number of the teeth to be moved. We don't know how many teeth you have to move on a particular patient, right? So you have to go and see how many teeth you have to move. So that according to that, you can take a good anchorage. Then type of the teeth to be moved. Okay, the type means what? If it is a very slender anterior, okay, you have to say, or if it is a very multi-rooted teeth, so there's a difference, right? The type of the movement, what kind of movement you need. If it is a Bodley movement or is it the kind of tipping movement, you have to see that also. Duration, how much time it might take. Skeletal pattern. Okay, patient exhibiting increased vertical skeletal growth pattern show more tendency for mesial tooth movement and anchorage loss. Okay, so that comes in skeletal pattern. Okay, now the patient who is having a horizontal skeletal growth. You know what is horizontal and vertical skeletal growth, right? This happens in both skeletal growth. So there is vertical and horizontal. Now, when it is a horizontal skeletal growth pattern patient, they show lesser tendency for the mesial movement of the anchor teeth. Okay, this is just because when it is a horizontal growth patient, they will have strong facial musculature. That's the reason we tell like that. Then what? Then occlusal interlock. A good buccal occlusion may act to resist tooth movement. So these all are some factors that according to what we have to plan and encourage. So these all are some requirements. So this was a very short topic, the anchorage one. So we started from what? We will again see. We started from the basics, definition. So the intraoral source that you have teeth, you have alveolar bone, musculature. Okay. For extraoral, you have cranium, cervical anchorage. You take it from the facial bone. Then you have Moyer's classification of anchorage. Then you have types. Then there is the single and stationary. Then you have reciprocal, you have intraoral, you have extraoral, you have muscular, you have intermaxillary, intramaxillary, you have the single, you have compound, you have multiple. Okay, and also we're talking about the anchorage planning. So that's all about this class. So if you have any doubt, you can contact us. If you have any questions, please contact us. So that's all for now. We'll see you in the next class. Bye.